is tomorrow. George?
It is incredible. We're here with a cardiologist right now as well for our GMA cover story. Dr. Turner, we're here to talk about a new study about the effectiveness of non-surgical procedures for chronic back pain. Thanks for coming in. Tell us what's in the study.
Well, we know that back pain is so common and extremely disabling. And over the last 20 years, we've seen a rise in these interventional procedures like epidural steroid injections and nerve ablations. But the question, George, is do they work? And the data or guidelines so far have really been inconsistent and based more on expert opinion than actual research and evidence. So this study took a panel of 22 individuals, experts, clinicians, even patients, and they reviewed 81 studies, and they in fact found that the evidence is really insufficient in terms of pain relief with these treatments, and they are not recommending them. And they also highlighted the cost. So some of these procedures cost anywhere from $1,000 to $6,000 per injection or treatment. People have to go frequently every few weeks to a few months, which is an additional cost. And there is a small amount of risk associated, things like infection, even stroke, paralysis, pain and stiffness, change in mental status. So really at this point, not recommending these injections.
Yeah, I'm glad the study came out. Many years ago, my daughter was dealing with back pain, and we tried those, and they did not work.
Exactly.
At all. But what are some of these other alternatives?
So certainly things that seem to work: exercise, physical therapy, keeping active. We think about mind-body techniques, even cognitive behavioral therapy, massage, heat. And then there's medications like non-steroidal anti-inflammatories, Tylenol, even some antidepressants like duloxetine. Surgery is really a last resort. It's typically not recommended, but if you've been suffering and really disabled for a year and have tried these other treatments, then surgery might be an option.
Okay, thanks for coming in. Robin?
All right, George. Now we have a new hockey tournament with a